see some of your assignments, not everybody's assignment. Still, I think there are some improvements to be made. We will discuss that today because we have professional academic writing to discuss as well. So I will discuss that also. Do you all see the slides, students?
Yes,
Can
Miss
you?
Fancy.
Okay, okay. So just a quick 5 minutes recap. We are in the unit of professional development and academic writing skills. So we are already done with learning outcome 1, learning outcome 2, and we are already done with learning outcome 3, right? So today and hopefully by next week, we will be finishing the learning outcome 4 and 5, where you will be able to use reflective practice to evaluate your development and how you apply appropriate academic conventions in written communication, right? So, for example, today we will learn about models of reflective practice. Yesterday we learned about the word what is reflection, right? Today we are going to learn a little bit more in detail and we will do a bit of revision in this, right? So you all already gave me a wide variety of definitions. Some of you all told me about recalling what you did, right? If it is your personal growth, if it is your personal development, right? It's about you trying to recall what you did or to see how well you have progressed on something, right? And then we are going to also learn about how you apply reflective practice techniques to improve your performance, right? And then to evaluate the effectiveness of own reflective practice, right? And then the final one is to apply the appropriate academic conventions in written communication, right? What are the principles of academic writing? So all what you all have been doing now is academic writing, right? So the way your introduction, your body, your conclusion, right? All that. And then how you produce a written work according to the academic convention. So this is what I did a small presentation just only on academic writing. Today also we will discuss about it if we have the time, right? So this time I have little examples based on what you all submitted, right? And I saw still some mistakes. I saw one student, I don't want to mention the name, but completely there is no in-text reference. The bibliography is not given in the assignment. So I was quite shocked and I don't know whether it's going to be a serious problem or not because in-text reference is there, but the final references is not there at all. එහෙමම in-text reference එක දීලා නැහැ. Right? So I don't know whether they have to repeat that assignment or I have to talk to the GM. But I just emphasized this so many times, right? That's what I kept on asking again and again. One reason I repeat a lot of things again and again because either y'all don't listen or either y'all forget what has been taught, right? So you need to like be very mindful and attentive in exactly what I'm saying, right? Mama කියන දේ, don't take it as, oh, this is same thing being mentioned, this is repeated. Don't think, because what I see is after repeating so many times also, instructions are not followed, right? So I don't know what's going to happen, but I have to talk to the GM and see what I need to do, right? So the final one is how you apply the appropriate academic conventions in written communication. So I already told you, professional development is also about your talking, right? Your writing, your speaking, about everything. So even about your dress code, how you dress. I already told you all, when you are doing something in a board meeting or if you are in office work, you can't be wearing what you are wearing in house, your nightgown, right? It has to be different. Likewise, the way you talk to your mom and dad is not the way you can talk to your teachers or your lecturers or your boss or your superiors, right? It is different, right? And the way you talk to your spouse is not the way you talk to your children. The way you talk to your children is not the way you talk to your parents, right? So different communication will occur between the type of people that you are communicating with, right? And also when you are writing something, it's not the same style when you write to somebody close and when you write to somebody professional, right? So that is why I always say you need to know the professional etiquettes or the professional rules when it comes to academic writing conventions and how you apply these techniques, right? So we have already discussed this, why professional development is important, right? Then we learned about capacity, capability, and competence. We discussed this yesterday. We learned that there are barriers in life and there's barriers in professional development also. And the main part is when you have barriers, you must always identify how you can overcome these barriers, right? Then we also learned about different sources available for professional development, right? Education, research, right? seminars, skill-based training, and so on. And also we need to know what are the goals and targets for a professional development plan, right? We need to develop a new set of skills, right? And like I mentioned yesterday, the most important thing in life is KSA. K stands for knowledge, S stands for skill, A stands for attitude, right? So like I said, no matter how many diploma certificates or how many degree certificates you have, it will not be of use if you don't know how to execute your theory knowledge into practical knowledge, right? I could be lecturing for hours and months and years about academic writing, but if you all don't make use of exactly what I'm teaching you all and understand exactly what I'm explaining to you all, or do the right thing in the way that is expected, you will not be able to improve your academic writing, right? So it's okay to make the mistake, but it is not okay to make the same mistakes again and again and again. Now, last time for written academic writing, most of you all sent me a draft, right? Even this time I will ask you all to send a draft. And I mentioned many times about referencing, and still after giving advice and guidance, still the same mistake has been done, right? So that situation is you have to take responsibility, that you have to be a little bit more mindful and you have to be a bit more careful when you all are submitting your assignments, right? So new set of skills you have to have. You have workplace skills, leadership skills, professional skills, right? Professional network mean like how you try to create a network through LinkedIn, Facebook, like that, okay? And we also learned this very important word called the benchmark, right? We need to know that benchmark is something standard. Like, for example, if you are not sure of a product, the standard thing to go is your benchmark. Like the standard thing for a consumable product will be the SLS or the ISO symbol. So as long as you have the SLS or the ISO, you are confident that you can purchase this particular product, right? So as a component of total quality management, benchmark is a continuous process by which an organization can measure and compare its own process with those of organizations that are leaders in a particular area. And we learned there are internal, competitive, functional, generic benchmarks. Actually, these four terms are not really important, but if you need one thing that you have to take home with you is what is benchmark. This is the most important part that you need to know, right? And then also, I told you yesterday, if you don't have job satisfaction in your career, right? Sometimes all of us, sometimes we have issues with our job. Sometimes our boss is too bossy. Sometimes the person that you're working with is difficult, or you don't have moral support, or you don't have colleague support. You don't have employee support, right? So you're all alone. You are new to the place, right? And sometimes there are situations you ask yourself, do I really need this job, right? But in a situation like in Sri Lanka, whether we like it or not, we have to do a job because right now, of the situation that every Sri Lankan is facing, including me, even though I am not in Sri Lanka, it has affected me also in an indirect way, right? Because I have parents who are relying on children, right? So I, as a responsibility, have something to do for my parents, right? So I need to first of all get myself stable, like there are a lot of responsibilities. So all of us who had to go out of the country, leaving our loved ones behind, is not because we wanted to do it, but because sometimes there was no other way but exit the country, right? So in these situations, if you don't have job satisfaction, what you need to do is like you might have maybe one friend who is like you, who thinks like you, so have coffee breaks with them, organize lunch breaks with them. And even if you feel you don't have anyone, try to do something on your own. Maybe right after work, you go to the gym, or you do a dancing, or you go to Zumba, right? Or you do your music, or you play, or you spend some time outside your workplace with another friend, your school friend, college friend, anything, right? Try to find a way where you can have a job satisfaction to continue that job. And like I said, like you all, now today I did the batch one. Many of the students are like ladies were all housewives. They are not doing anything. And very sad when I asked the first question, why do you want to do this diploma? 100%. If I had around 15 students, all 15 students, they answered they're doing this course because they want to leave Sri Lanka, right? They said they are doing this course because they want to leave Sri Lanka, right? So it is a very sad state that if you ask today, 75 or 95% of the people in Sri Lanka, if you ask them, they all want to leave the country, right? They all want to leave the country because that is a situation we are in, okay? Right. So, yeah, taking relevant courses. So now we have many examples with our own, your own experience. You all told me like you all want to do something to keep yourselves improved. You all want to upgrade your skills, right? Like due to different reasons, you all told me you all are taking this diploma course. So that is a good thing. Now, after finishing this course, don't stop there. If you want to improve in your English, take a course that you can improve in your English, right? So don't stop learning, right? Because your brain will continue to have that. අපි කියනවා in English we have something called plasticity. සාමාන්‍යයෙන් අපි කියනවා අවුරුදු 25න් පස්සේ වැඩක් නැහැ ඉගෙන ගන්න එක වැඩක් නැහැ මතක තැබීමේ ශක්තිය අඩු වෙනවා දේවල් අමතක වෙනවා ඒවා ඔක්කොම කියන බොරු, right? You are telling a lie to yourself. එක නිදහසට කියන කාරණා දෙයක්. හරි? You can't say ඉගෙන කවදාවත් as long as you keep on feeding your brain with knowledge and skills, trust me, you are never going to get outdated. Hari? It's the same with your body. සාමාන්‍යයෙන් අපි කියනවා okay after 30 වැඩක් නැහැ. ඉතින් කොච්චර කරත් අපිට මහතම තමයි. No, that's not wrong. You have that determination and that discipline to eat healthy, right? To do exercise at least 3 times a day, right? You are what you do to your body, to your mind, to your soul. Right? Remember that. Rest of all, you're giving excuses to yourself, or you're lying to your own self. Like personally, ඇත්තටම මට නම් I just cannot stay without doing something. Like even Saturday and Sunday, I don't want to, like I told you all yesterday also, මට නිදාගෙන I don't like to just be lazy. I want to make sure that I do something productive every single day. It's okay to take a rest. You can sleep, you can watch a movie, but try doing that same thing for a continuously. You will be so bored in life and you become very unproductive to yourself, right? Shadow another department. Like I told you, I will tell you another personal experience. Like I have a key superior who is less qualified than me and who is more older than me. But there are certain things that he does skillfully, which I don't have in myself. So I like to observe him, how he does, how he planned, because he has been working for around 19 years. So of course he has more experience in what he's doing. So, and I am new to the department. So even though I am education or qualification wise, I am above him, skill wise, he has more practice and training and experience. So I like to always shadow him, watch him, what he's doing, right? And find a mentor. Like I said, you always have somebody who is superior in terms of experience. Like if you are joining a new department, try to find that person will guide you in the right direction, right? It is very important. And how you set professional development goal, like I said yesterday, always know what you are working towards, right? If it is writing that you are working towards, write it down. That should be your goal. If it is written communication, or yesterday Janaka told, he wants to improve more in his writing, in his speaking, right? Speaking in English, right? And Taranga had her own goals, right? Mitni has her own goals, right? So you already have what your goals are. So work towards that, right? Have your SMART goals. Taranga already told us it is specific, measurable, attainable or achievable, relevant and time bound, right? Then how you create a personal development plan in health and social care, right? So I already told you, have monthly goals, weekly goals, yearly goals, right? Every day you have to have a goal. There is nothing that is completed for you. If you are good in speaking, try to be good in your writing. If you are good in speaking and writing both, try to improve in another skill, right? There are so many skills that you need to improve. So write it down what you need, right? And benefits of using a personal development plan. So yesterday, some of you all told it will make you to save time. It will give you time to do something else, right? And also, what else? It will give you efficiency. It will motivate you, right? So I already gave you my personal experience. When I have lot to do, I write down everything what I need to do, and I will do what I need to do first. What is the most important thing that I focus first? That is the one that I will do first, okay? So it provides you with clear goals. It helps you to identify your strengths and weaknesses, right? So maybe let's say Janaka takes a course to improve his English, right? He will compare himself 1 month ago, 3 months ago, 6 months ago, 1 year ago. Of course, if he has worked in a discipline, in a timely manner, in an efficient manner, he could see that he has developed every 3 months, right? And then if he has not worked according to a plan, he will know his weaknesses was what? He was procrastinating. Procrastinating කියන්නේ දෙයක් අපි හැමතිස්සෙම කල් දානවා. සාමාන්‍යයෙන් හැම කෙනෙක්ටම including me අපි ආසයි දෙයක් කල් දාන්න. But for me now that habit has actually gone. Those days I used to submit exactly on the day of the deadline when I was in university. But as I became older, I try to submit at least 2 days before the deadline. Right now I have that habit because as the years went by, I realized it was a very bad weakness in me, like submitting everything on the day of the deadline, because I realized maybe because of poor time management or because I didn't know I had so much to do. But with maturity, with experience, I am able to now submit things at least 2 days before the deadline. Okay, so try to know what is your strength and what is your weakness. And I also told you I have a weakness. When I get upset about something, I tend to connect that thing to another thing, right? And eventually everything goes affected in a bad way. It becomes like a cycle. So, we used a word yesterday. Can you all tell me the name of the word we used? It starts with M. මොකක්ද අපි පාවිච්චි කරපු term එක ඊයේ? You need to be what, student? We said that when you do meditation also, you will go through that technique. Can you all remember what I was talking about? Mindfulness, do you all remember that term?
Yes, miss.
Right. So you have to be mindful about your strengths and weaknesses, right? Improve your employability, performance, motivation, track your progress to know what is the sense of your purpose. Right. Already we learned about SMART goals, self-awareness, personal growth, organize your time better. So in case if you get for your assignments, right, why do you need to have professionalism, or why is the importance of professional development important? You can write all this: increasing your self-awareness, increasing significant personal growth, to organize time better. All these things are inclusive for your writing, right? So everything is there in my lecture slides for your assignments, okay? So here, this is where we stopped yesterday. So we will pick up from where we stopped. So we learned about reflective practice, important in health and social care. So again, can somebody tell me a little bit, what is reflection? Anybody? Sinhalen unat kamak naha. Just tell me in your own word, what is reflection? Anyone? Students, what is reflection?
We identify our strengths and weaknesses about
Yes.
our works.
Yes, reflection. You're identifying your strength and your weaknesses. But can you tell me, when does a reflection happen? During what situation? The term. Through reflection, yes, you can identify your strength and weaknesses. But when does a reflection really happen? මොන situation එකේද අපි reflect කරන්නේ දෙයක්? At what situation? During මොන වගේ incident එකක්ද? Haranga, when do you reflect?
Example.
Yes, but I'm asking, in what kind of situation do you reflect?
Example, we finish our assignment.
Very
After
good.
assignment, we reflect our what are the weaknesses, what are the strengths, and what we can improve
Very good.
in
Excellent.
next assignment.
So that example is assignment. You reflect after your assignment. You reflect after your examination. You reflect after maybe you scolding a person, right? Sometimes you reflect. ඇත්තටම මෙයාට බැනපු එක හරිද? නැත්නම් බැනපු එක වැරදිද, right? Sometimes you might feel ළමයෙක්ට ගහන එක, sometimes for example if your child, right, හොඳින් කියලා තේරෙන්නේ නැත්නම් සමහර වෙලාවට situations ගහලා හරි හදන්න කියන එක වැරද්දක් නැහැ, but it depends, right? You can't go for child abuse. Now personally, I will give you an example. Today's generation's children are very how can I say, in a way, like the millennial children born from year 2000 onwards, not actually 2000 also, I would say starting from 2005 onwards, because I have students who are born from 2000 and they are quite okay, who are 18 years now in Sri Lanka, I'm telling. But the children who are born from 2005, I solely blame it on the parents for the behavior of the children. One thing is, I can't say it's only in Bangkok, but I have seen it's the same thing in Sri Lanka also. Sometimes Godak family case, what you call wealthy family, a family that has a lot of money and resources, ඕනම දෙයක් ළමයා අහන දේ දෙන්නවා, right? එතකොට what happens is this child doesn't grow with lot of wisdom, right? The child, then සාමාන්‍ය, I think Janaka and they might agree with me on this, and I think I will agree more. සාමාන්‍යයෙන් hardships වලින් හැදෙන ළමයි, they are very intelligent, right? Because ඒගොල්ලන් හැමතිස්සෙම පුරුදු වෙලා තියෙන්නේ survive වෙන්න කොහොමද, they have to always think outside the box. So when you try to think, Janaka, do you agree with me on this? සාමාන්‍යයෙන් like hardships වලින් හැදිලා එන ළමයි, they have a lot of challenges. So sometimes they are on their own and they think every time how they can survive, right? So I will explain to you, like one teacher that I work with is an African teacher. And what he told me was, if a child in Africa, right, skip school, if they bunk school, the punishment is the child has to be on the table while the teacher beats the child so that the child will never miss the school. Personally, for me, I do not go this law because it's a child abuse. And let's say the parents go and complain that the child was beaten in school. If they go and complain to the police also, what they do is will beat the child so that the child will not go into drugs or alcohol or into bad situation. And this African teacher told me that is why in Africa, you will not find anybody stupid, because, and that is true. Now there are around 7 African teachers that I work with, and they are all extremely intelligent. Their way they think, their maths knowledge, their English knowledge, their IT skill. Now, another friend who was an African who got the scholarship like me for the masters, she's already now in USA for a PhD. She got a PhD scholarship in USA because that is the upbringing of somebody who grew up in a hard condition. But if you give everything, right, in all the facilities, everything, the child will never learn on their own what is a behavior, what is manners, how you ask in a polite way, right? Today, when I teach somebody, they don't have the respect for a teacher, when to eat, what time to eat, how to talk, right? So I always try to correct that, because I had those discipline as a child, and I'm happy I had those discipline, right? I'm very happy as what my parents gave me, what my teachers gave me, the strict environment I had to live. I'm very happy, right? So reflection is, for example, now when I shout at a student, I also come back home and I will reflect. Is it a necessary thing that I did? And 95% of the time, my reflection is, I am glad I told what I had to tell this student, because every time when I do this, most of the students, they come and thank me and they say, Miss, I know what I did was wrong. I shouldn't have spoken like that. I shouldn't have behaved like that. So you have to know, when you reflect backwards, and if you think that you did a positive change or you had a positive impact on somebody, then a reflection is positive. But if you reflect, and for example, during an angry situation, if you have used a bad language at somebody, or if you have insulted somebody in public, the reflection is negative, right? So you need to correct yourself how you need to do it better, right? So reflective practice in health and social care is also the same. If a nurse has shouted at a patient for being bedridden, or if the patient is very weak, And if the nurse feels that what she did is wrong, she has to change to be a better nurse and treat the patient in a better manner, right? And when unexpected obstacles or circumstances knock, so like yesterday I told you, we all have unexpected obstacles. We have challenges that come in our way, right? But you have to reflect on yourself. Okay, what did I learn from these challenges? What did I learn from these obstacles, right? Now, for example, these 4 months, I had a lot of obstacles, but I would really feel proud about myself. In these 4 months of obstacles, I learned a lot of new things, right? Like, even though I studied in Bangkok for 2 years, trust me, I never knew how to take the BTS, the SkyTrain. I couldn't read a map properly to go to the destination I want because I had a lot of friends going along with me. But now I am working. I had to do things on my own. I had to go to the Sri Lankan embassy in Thailand alone, to the Thai consulate alone, verify my documentations alone, go to immigration many times alone. So I don't have anybody to support me. So I had no choice but to do things on my own. So I searched, how do I do this? How do I take the train? Like I sit and read. So that now mama වාඩිලා හිටියොත් මට බෑ කවුරු හරි මට උදව් කරන්නම ඕනේ නැත්නම් මට මේක කරන්න තේරෙන්නේ නැහැ. If I give that, you think I could get my things done? No. In a situation like this, I had no choice and I realized I had some strength in me which I also didn't know. That is why reflection is good. When you reflect, you realize how much strong you are, how much brave you are, how much inner strength you have, how much courage you have, how much talents you have within your own self, which you didn't even know before. That is why reflection is very important. So write down your reflections, right? Yesterday we spoke about mindfulness, continuous improvement, and reconnections with emotions and empathy, right? So you have to be, like I always say, connect with somebody emotionally and empathetically. It is a must. Janaki, any questions do you have up until now? Taranga? Taranga, we lost you yesterday in the half of the session, I think, around 15 minutes.
Yes, miss, my in that power cut.
Okay, I thought so. Okay, no problem. Yeah, so I think this is where we stopped yesterday. So what task did I need to complete? What did I do? How could I have done better, right? So these are the questions you could always ask yourself, not just in healthcare sector, but in whatever the personal goal or personal professional goal, whatever the goal that you are doing, always ask, what task did I need to complete, right? What did I do? How could I have done better? Yes, we spoke about reflective practice, right? Is a critical evaluation and self-assessment. It can enhance professionalism and it can continue the professional development, right? Taranga, were you here for this lecture? I think this is where you got disconnected. Reflect, plan, do, and record.
Yeah.
Yeah, okay. So yesterday we learned a cycle called the reflective practice. Taranga, I would like you to answer as a daycare person who's running your own daycare.
Yes.
How would you start this cycle? From where would you start? Actually, the starting part is plan. So can you tell me, how would you follow this cycle? Can you tell me?
First I am planning.
Planning what, Taranga? Give me an example.
Okay, it is about concert.
Mm-hmm.
Okay, we are planning to do the concert on December.
Mm-hmm.
So I am making the schedule.
Okay, good.
What we are going to do,
Mm-hmm.
what kind of dance I'm going to include.
Very good.
Kind of things like that agenda I'm going to make.
Okay.
Then after that, following that plan, I am practicing with the kids and with teachers.
Okay.
Before that, I am discussed with the teachers. Then after that, I am starting practicing.
Okay, good. So
then while practicing, I am doing recording and other kind of things, and I am checking what are the mistakes they are doing. And that means then I am reflecting.
Right.
What are the mistakes? Then
very
after
good.
that, I am correct it and going to do it better than next time.
Right, good. Thank you
Last
for
time.
that. Very good. Methni, can you give me an example for this cycle? This is a very important cycle. Methni, anything, your
Okay.
personal thing. Okay.
Actually, when it comes to assignments,
Uh-huh.
I first plan in my head what should I start, what are the topics,
Yes.
and how should I write for my assignments.
Yes.
Then next, I write my assignments.
Yes.
And check whether where I have made mistakes. Then I record myself whether I have made mistakes, where should I go wrong, and what are the references should I put. Finally, I reflect, ma'am, what I have written, whether it is suitable for the lecturer to check my assignment, whether she agrees with my assignment. Like that, I reflect on my work, ma'am.
Very good, very good. So that is a good example too. I think Janak already told his example. What about Lumal and the rest of the students? Can you all take an example and just give me? Because if not, it's like I am talking and I don't give you all some time to talk. What do you all think? Any example that you all can think of? Who are the other people in the session? Yes, Roshan, Tilani, Pubudu. Oh, Rifka, you're here today. Nice to have you on the session.
Yes, thank you, ma'am. I'm sorry I missed the class yesterday. So, reflective practice, can we take any kind of an example?
Anything. It's okay about your own personal, no problem.
Okay.
Or any example. Can you give an example that you can think of?
Reflective practice. Now, can we, now, say, for an instance, can we take some kind of a work or some kind of an activity we do,
Yes.
like maybe the previous year's activity, some
Yes.
kind of an activity.
Yes.
Okay. It can be related to studies or work related or anything like that.
Anything. Now, anything. Now, Taranga told about her concert, how she's planning in December, how she's going to do. She's going to record to see how they are doing well. Then she says she's going to reflect on how well they can perform better next time, right? So, likewise, can you give an example on a reflective practice starting from plan? Anything. Maybe from your workplace or your personal thing that you can think of?
Right. Okay. Personal thing, Miss Afrida, I was thinking maybe to take a personal experience.
Okay, go on.
Okay. So maybe the chores which I do at a day-to-day basis.
Okay,
so
good.
if I'm to take my children to school and to make them study,
right,
to help them with their studies, so that
Right.
will be my plan.
Very
so
good.
maybe this year I'll be maybe I will make them a timetable, and I will guide them as how they can do their studies, and how
Very
they can do their activities with related to their studies.
Right. Good.
So, and then depending on that, I can check their progress.
Very good.
Progress.
Yes.
Yes. That check their progress, and then I can see what kind of results they have achieved during that period of time.
Yes. Very good.
Okay.
So
So that will be that will be my reflection. So depending on that, the next year, if there are any improvements, I can if I can make any improvements and make any changes for me to make it better, I will do accordingly.
Okay, good. So that's a very good example. I think whoever have children and want their parents to give some advice, that's a good thing, right? So if you want your child to do very well, you make a plan. Okay, so you make a proper plan where they can have some break. Then if they are very weak, then they have more time in that particular subject, right? Then you do that maybe you put a timetable for them, right? And then you record based on your plan. Are they improving compared to 1 month or 2 months? Okay. Reflection is, was I too hard on my child in this plan? Maybe I can go a little bit easier. Was I too easy? Can I go a little bit harder on them, right? So you reflect, right? So Rifka gave, Taranga gave, Janaka yesterday gave it to me. What about Lumal? What about Lumal, Roshin? Would you all like to take? Metni also gave, right? Yeah, Metni also gave. What about Pubudu? Can you give an example? Anyone? No problem. Maybe.
Yes, ma'am, I am Pubudu.
Yes.
Yeah, I am doing my own business, which is renting a vehicle for a long period basis.
Yes.
So if I am saying when I am planning to buy a vehicle,
very good.
First of all, I check whether I have the feasibility,
right?
Whether I can spend money,
yes,
or I can obtain, whether I can obtain leasing or like
yes.
that.
Yes.
And if feasibility is okay, then I'm
yes.
Buying a vehicle.
Yes.
Then after that, mostly we have to pay 4 years or 5 years, something like that period to complete to obtain the vehicle. So
okay.
For my my theater.
Oh,
after that, I have records. So whether I can understand through my records. Is it okay to pay the leasing amount and මං දින සල්ලි ටික වැය කරපු එකේ ප්‍රතිඵලයක් තියෙනවද කියලා ඒ report මං ගාව තියෙනවා. After that I am in reflect I can check whether I can go to next time a higher vehicle or a lower weight vehicle next time.
Very good, excellent, right? So anybody else who wants to give thank you Pubudu for that, thank you for answering. Anybody else who like to give an example? Another one more, please interact, right? I'm gonna
yes ma'am.
Yes, go on.
Sam Tilani.
Yes, Tilani, go on.
This is not my individual reflect, ma'am.
Yes.
As a public health team,
yes.
We reflect our past month duties.
Okay.
And
your past month duties. Okay.
Plan in next.
Okay.
And we called it advanced program. We make the advanced program and plan our public health duties and school duties and antenatal clinics and all things. And we do that things we gathered and we do all things.
Right.
And day to day we record all duties in our diary. And end of the month, again we reflect our duties.
Very good. Okay, thank you. Metni, you are working as in a healthcare sector, right? I can't remember, but I remember you work with the healthcare sector. Do you work with the healthcare sector, Metni? I forgot.
No, I'm not working, ma'am.
Yeah, you are a student. You are still doing your
Yes.
A-levels. Okay, sorry. Okay, right. Okay.
That's all right.
Okay, so that is an example that you gave. Very good, right? So actually what I wanted to say before Metni answered is I'm actually going to miss all of y'all because you all interact a lot, but the batch that I'm teaching now, only 3, maximum 2 people are like confident to talk because they fear to talk other than in Sinhala, right? So I have one student who is a nurse. He talks. So I like that, right? So interact like that. So the more you give your experience and what y'all are giving example, it will help you to understand. So for me, yesterday, I think I told this to Janaka, as a lecturer, I will plan my lecture slides, what I'm going to do for you all today, right? Then I conduct the lectures or conduct the class. Then I will have a recording. There are the people who missed a class can watch it again, or the ones who want to re-watch again can watch the recording. And as a lecturer, I will reflect, okay, what could I do better? What could how can I help them in their academic writing? Maybe I can ask them to send the draft so I can give them a feedback, right? I reflect, right? So all of us, including myself or including the best of expert, nobody is perfect, right? Everybody will have a situation where they have to reflect, right? Be it in their career, be it in their profession, whatever they are doing, they have to reflect, right? Is there anybody who likes to volunteer, the ones who didn't do, to take the opportunity to go through this cycle on an example? Anybody who likes to do it? Okay. Right. Advantage of reflective practices in registered veterinary nurses. So the students who didn't come yesterday, like Rifka and all those students, we took a advantage of a veterinary nurse. Rifka, do you know who is a veterinary nurse? Can you give me as what you think? Who is a vet? Do you know who is a vet usually?
Yes.
Yes.
Yes. The animal, the people who look into stuff related to animals.
Animal. Yes. Yes, an animal doctor, right? And they usually, if you have a dog or a cat or whatever the animal, right? If they are sick, you will take it to the vet, right? Veterinary doctor. But this is a veterinary nurse, right? You will have nurses also who are doing this job, right? So to improve an RVNS technical and scientific knowledge, right? So for example, let's say there is a veterinary nurse who looks after animals that get sick, right? They also will have a reflective practice, right? To improve their scientific knowledge related to treating the animals, right? And their ethical and personal capacity. Then api samane, the way we treat a human is also the way we have to treat an animal, right? There are ethics that you have to do. Now, for example, one thing now, when it comes to medical research, there is a lot of ethical problem. There is one sector who really loves animals, says it's unethical to do clinical trials on animals. So like if I have to go back a little bit, අපි සාමාන්‍යයෙන් clinical trial එකක් කරනවා නම් clinical trial එකේ stages 4ක් තියෙනවා. Phase 1, phase 2, phase 3 and phase 4. Phase 1 and phase 2 clinical trial ශ්‍රී ලංකාවේ කරන්න බෑ because අපිට ඒ facility නැහැ, resources උත් නැහැ. සාමාන්‍යයෙන් clinical trial phase 1 and phase 2 it happens in India. Right? They have that facility, the money and everything. That is why when I was doing clinical trial in Kaluboila Hospital and National Hospital of Sri Lanka, we have a lot of auditors coming from India because many people, they are very good at when it comes to clinical trial. Documentation whether Indians are very good at it, right? And they do it in a very mass scale. Like even back in Thailand also, they have a lot of clinical trials where they do it on animals, right? And only phase 3 and phase 4, we do it in Sri Lanka, where we check on sick patients, and if it is workable, right? Phase 3 means you do it on human beings. Phase 4 is once it is successful in human beings, you will do it in a marketing stage. You will release the drug to the market. So the trial that I did, dengue trial, the vaccine is now approved, right? And hopefully in another 2 years' time, we will have a dengue vaccine, right? Because it is already found to be effective. You call two things, efficacy and safety. Efficacy means how effective that is. Safety is that you don't have any side effects, right? So both of them are now good. So hopefully in 2 years' time, we will have the vaccine. And there's another study that I did was for heart attack patients. Like usually when you have cholesterol, right? You give a drug called statins, atorvastatin, simvastatins, right? All those statins we give to reduce the cholesterol level. So the clinical trial that I did, we found a drug called alirocumab, right? It is an effective drug and it was published in New England Journal, one of the best high impact journals in the UK, right? And hopefully that drug also will be available in 2 years' time, right? So patients who are having high cholesterol level can take that drug, which is found to be more safe than statins, because even my father, he takes statins for his cholesterol. But after some time, the sad part about statins is ඒගොල්ලන්ගේ ගොඩක් muscle wastage එක යනවා. They lose a lot of muscle wastage and they start losing weight and they become very thin. ඊට පස්සේ කාලයක් එක්ක their bones become very stiff. ඒගොල්ලන්ගේ walking speed එක අඩු වෙනවා. They become having a lot of muscle pain, right? So මේ වගේ side effects අඩු කරන්න තමයි we have found another drug called alirocumab, right? ඇත්තටම clinical trial is a very good thing. right? Because most of the drugs that today people are using for cancer or even paracetamol, whatever the drug that has been effective, you have to go through clinical trial, right? So the argument that comes is, why do we need to do it on animals? They are also living creatures. And actually, to a certain extent, I understand, I agree. But at the same time, can you give a toxic dose to a person and check on them? Right? ඒකයි අපි සාමාන්‍යයෙන් when I was doing my clinical trial in NHSL and Kalubowila, we have something called the informed consent form, ICF. A ICF එකේ හැම දෙයක්ම කියලා they tell about this clinical trial, what are the side effects they can have. Sometimes, even though it is effective on animals and after few people, sometimes still certain side effects can come, but still we are working with doctors and consultant doctors. They will always take care of you, right? But you have to always tell the truth. You can have these side effects. Do you still want to be in the trial? You can always quit in the middle of the trial. You have to be having ethical practices, right? So even as a veterinary nurse, they need to improve their ethical and personal capacity when treating an animal, right? So now what has happened is, to prevent the clinical trial on animals, they have found something called stem cells, right? Stem cells can generate your normal body tissue. They can create an artificial heart. They can create an artificial liver. So instead of checking on the animal, now they can check on these artificially manufactured organs, right? Because they want to safeguard animals to a greater extent. And I think that's a good thing, right? Also, it is an integral to the development of professional status and fulfills professional responsibility, right? So because our module is about professional development, we have to understand everything that we are doing has to be professionally. Even if you are dealing with a patient or a client or your employee or even your students, right? I have to behave professionally, and likewise you all behave professionally. That is the way, right? So RVNS, or you can say reflective practices in registered nurses, can develop their specialism. So yesterday I told you, if a veterinary nurse or if a normal nurse knows how to develop herself professionally, she can even go further to being a doctor. She can become a vet doctor instead of a vet nurse, right? So if, like, of course, I told yesterday, whoever wasn't there, the amount of salary that you get as a nurse is different to the amount of salary that you get as a doctor, right? So if you develop your career or your profession, right, in a professional way, it can help you to improve yourself, right, or progress yourself to a better career role, a career pathway, right? Because another employee can hire you for the next stage, okay? Is that clear, students? Is it understandable, or do you all have any questions? Sorry about the background noise, but do you all have any questions? Rifka, is it clear about the advantage of reflective practices in registered veterinary nurse?
Yes, ma'am.
Okay. Rifka, in your professional career, in whatever you're doing, what are the professional aspects? Because you are not there since I started this module, so I would just like to ask you, what is the main professional criteria that they expect you to do when you are working?
Now, at the moment, I'm not working, ma'am. But when I used to work, like as you say, there is a code of conduct we have to adhere to.
Yes.
And once we get employed.
Yes.
So there are certain rules that we have to. Now, when I was working in the back office, bank back office, so we are not supposed to reveal any details with regard to the client's accounts.
Right. See. Okay.
So that we have to safeguard the what do you call their identity, safeguard their privacy. So that is a rule we had to abide by. And also like when handling the complaints or like queries, or like when we are to update any databases, there are key performance indicators which we have to adhere to. So
Right.
they will give us a set of guidelines. According to that, we have to process and do whatever the work we are like doing.
Right. Right. Okay.
Yes.
So can you
And,
see? Yes. What
yes.
else?
On top of that, professionalism, the customer service, and everything has to be in a very in a good. It has to be in a quality level.
Yes.
So there's so many things we have to adhere to.
Exactly, to look into, right? Yeah. So what about when you have challenging customers, like සාමාන්‍යයෙන් අපි කියනවානේ හරි වාත customer කෙනෙක් කියලා. සාමාන්‍යයෙන් sometimes we do the best to the customers, but still people complain, right? Usually that is the attitude of Sri Lankans. Like sometimes we do the best, right? Sometimes it is actually both way. Sometimes the people don't do the proper thing, like especially in the healthcare sector. I personally have seen how doctors and nurses talk to the patients, right? But at the same time, I have seen in private sectors like Dialogue and all, sometimes customers come and be very unreasonable to the bosses and to that employer, right? Employer or whatever, right? So in that situation, Rifka, how do you handle difficult clients, difficult customers in a professional manner? Have you had experience like that, difficult clients who really are a pain?
Yes, like very irate customers. We have had, I have like come across that kind of customer. So what we normally do is at that time when the customer is like in a very aggressive and in a very bad state of behavior, what we normally do is we will let him vent out whatever the anger he has at the moment. So we will keep our mouth shut. We will be composed. We will be calm. And we will not talk. We will let the customer vent out the whatever the frustration he has at the moment. So there will be a point when he is a little bit calm where we will be able to look into his matter, to probe and to ask questions. And before asking questions, we will, on behalf of our company, what we will normally do is we will apologize for the inconvenience which has been caused to the customer, and we will say, we understand your situation. And what I normally do when I come across an irate customer is I will put myself into that customer's shoes. Right. So what I normally do is, now it is a normal life. I feel it's a normal human behavior. Now I will work in Dialogue, and after my shift, when I go to some other place, it can be a restaurant, it can be a government agency. We as customers, we normally expect 100% service.
Yes.
So no matter what a sector we are in, once we exit our career and once we go into the normal personal life, we as customers too expect that kind of treatment from a care provider, from a service provider. Yes. So I normally put myself in that situation. So and then I normally deal with the customer.
Right. Very good. So yesterday also I said I also have an issue when it comes to anger. Right. I also have a lot of anger issues. Like sometimes when people are unreasonable, I take that anger on them. But as a reflective practice, actually, now I know, I think I have better control with anger. Like I think as time goes, of course, our responsibility is becoming more and more. So it was not like how I was a student when I'm doing a job, right? Responsibility goes because I have responsibilities to think about my family back at home, right? And myself. So as a professionalist, I also need to know when I have anger issues, how I manage my anger, right? So like I like what Rifka said here. When the customer shouts, okay, she said they become very composed and calm. This is a very good professional quality, right? There is another problem in Sri Lanka. Usually I don't have this. When I'm angry, I have a lot of self-control about the language I use, right? But majority of the Sri Lankans, when they have anger, the main thing that they use is they use bad language or foul language, because that is a normal thing, right? But you need to know, you need to have better self-control. because this is a professional development situation that you are in, right? So calmness and composure is very important. Taranga, what about your situation in a running a daycare?
Yes, I am handling very small children, so
Yes.
we need kindness and also the calmness also.
Very good.
We can't get angry.
Exactly.
And also I'm doing the autism children.
Imagine.
So,
yes. Yes.
We have to we have to control our anger and be like a child. Yes. And control them.
Yes, because I understand if your students are autistic, right? And if you're teaching the children, they're very different to, for me personally, I really cannot control small children, right? That's what I like to teach adults. Because for me, I think I lack that patience and I lack that, calmness. But I know that is not a good thing, which I feel I need to, that's what I said, like I said, including myself, there are always things that I can reflect and work on, right? So if you are someone who has a lot of patience, calmness, tolerance, right? Like for me, I will be truthful. Like if a student comes to me many times saying, Miss Afrida, I can't understand, can you please explain to me? I have a lot of calmness and patience to be kind to them and teach them. But personally, it is very hard for me to do what Taranga is doing right now, like handling
and
bunch
also,
of small
we have to ignore them. That sometimes they are crying and shouting and some kind of things they are doing. So I am doing is I am ignore them and ask them to settle down by themselves.
Yes, exactly. So these are all training courses, as I'm sure you have something called like as far as I know, some of the teachers who went for this, very small teaching children, they child psychology.
The course, Miss, in Daddy's Lanka.
Okay, because some people do child psychology before starting all these things before they teach a small children. So it's okay. Everything is a practice reflection process. Janaka, what about you as a manager? Your personal experience, professional development in difficult situation as a manager. How have you handled people who are under you? Would you like to share your experience? If you're online or anyone. I think he is not there. Metni, what about you as a student? What is your challenges as a student with your teachers or with your colleagues? Do you have anything that you had to be professional? Can you share with us?
Yes, ma'am. Actually, I had a personal experience as a student.
Right.
One day I sent one of my assignments to my teacher. She said that she didn't get it. I calmed down myself first. Okay, if she didn't get it, again I will send it.
Right.
But time to time she told me that she didn't get it. So then I asked the teacher, ma'am, why didn't you get my assignment? Then she said, you didn't send me. So actually, I told her that I sent it through the coordinator. Then she called me and told that he got it all my assignments through coordinator.
Okay. And so, what was the professional dealing that you had to go through?
It was that, ma'am, I just have to calm down myself.
Okay.
It was my professional deal.
Okay, so maybe in that situation, because I don't know really what happened, so maybe in that situation, maybe it's a lack of miscommunication or maybe a misunderstanding. So maybe in that situation, either you could have asked her what is the exact way to submit. Is it through the coordinator or is it through the personal way, right? Or maybe what she would have done wrong is if she has not received it from you, she could have either guided you better that you send it to the coordinator and the coordinator will email it to me. So like usually if like, for example, in my situations also, like what Mr. Rishad said to me was like, usually only my students have submitted the assignments exactly the correct way. Because Ms. Ganguly and Ms. Chammis, they have submitted in different parts. Part 1 separately, part 2 separately. Sorry about the background noise. Sorry, students. But in my situation, in my all of y'all, I'm very happy that y'all have understood my instructions very carefully. They said that with my assignments, there were no problem, that everybody has submitted as one document. That is task 1 and task 2 as one document, right? So it's always about communication, right? Understanding what you need to do. Students, hold on a second. Just give me 2 minutes. Right? So Mekni, your experience, I can understand, but at the same time, you also need to know what mode of communication. Did you understand exactly what you need to do? And if you feel that whoever you are submitting to is also not understanding, then you need to convey that message to that person also properly, right? So I will also tell you, usually when I have to talk something important, I refrain myself in text messages. I always prefer to communicate and converse something via verbally, right? Because I know there can be misunderstanding that can happen, right? I know that misunderstanding can happen, okay? So, okay, I think any other questions with regard to the reflective practice? So you all already gave your experience. That is very good, right? You all already told why do you all need to do this to increase your professional status, the professional responsibility, right? Very good. All of you all had your own personal experiences. Okay, that's good. Okay, right. Now we are going to discuss about the role of reflection in outcome-based CPD. Can somebody tell me what is the meaning of CPD? Can anybody tell me what is CPD, students? Does anyone know what is CPD? Students, can anybody tell me what is CPD?
Certification.
No, CPD stands for Continuous Professional Development, right? Continuous Professional Development. Taranga, we use that word here. I think I'll just show you all. I think we used it. I'll just show you the second slide.
Madam, first slide, madam.
First slide, right? Yes, 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 yes. I also remember. CPD, I can elaborated it, but I'm using. Anyways, just remember CPD stands for Continuous Professional Development. Don't worry, it has been elaborated in the slides. You will find that in one of the slides. So don't worry, right? So students, actually, right now, I am actually like for 4 months, will you all believe I have not had a table and chair to sit and conduct a class, right? Because I am sharing with somebody and, you know, the way they want to live is not the way I want to live. Because of my visa issue, I had to like, you know, tolerate a lot of things, right? I had to put up with a lot of things. When you're with somebody, it's difficult. It's not. And finally, I have found my own condominium and apartment that I can move. That is why I'm actually out, because it's difficult for me to do a class even when she's around, right? So that's what I said. Even for me, past 4 months have been with a lot of challenges, right? But end of the day, what I want to say is the good times will come, right? I'm saying this to you all because it's very personal, but I'm just saying because I know it has a lot of background noise. but I never stop finishing the lectures for you all, right? Even with my situation and circumstances, right? It is very difficult when you don't have your own personal freedom, right? So I'm sorry about that. I feel upset that there's a lot of noise. Yesterday it was not that noisy as today, but today is a bit noisy. Yes. So anyway, just remember CPD stands for Continuous Professional Development, right? Okay. In the role of reflection in outcome-based CPD, the first thing that we need to do is we are planning. So we are going back to this cycle, right? We are going back to this cycle, right? So the first thing you need to know is we are planning, right? Can somebody tell me, when we are planning, we will first ask the question, what, so what, and now what? Students, is the noise too much for y'all? Or can you all hear me? Or is it hard for y'all to hear?
Can hear me.
Okay. Right. So for example, if you are planning, right, the example of question is, what happened? What was I trying to achieve? What actions did I take? What was the response of others, right? We will ask these questions, right? And so what is the theory knowledge? Like example of question is, so what does this teach me? So what was going through my mind, right? So I will give you an example. When you have an anger situation, you have shouted at a patient, you have shouted at a client, right? You can ask yourself, what happened? Why did I react like this? By my anger, what did I try to achieve? End of the day, usually by anger, you don't achieve anything, right? When you are angry, you don't achieve anything. Either you will feel guilty about it or either you will regret about it, right? So next time when I'm going to be angry, what are the actions I can take? Can you all give me some strategies that has worked for y'all when y'all are angry? Saranga, as a teacher, what helps you to control your anger? What helps you in your anger management? Let's ask each one of your personal experience. Students, can you all tell me what has helped?
Talking. And I'm avoiding the situation. I'm going
right
and coming back again after controlling my anger.
Right. And Rifka, what about you? What helps you to control your anger if you are angry?
Yeah. Yes, Miss Afra, this may, sound like a cliche, but I believe I will count up to 10. Or
very good.
If I'm very angry, I will count out up to 20.
Right.
And then I will try to calm myself down. Now, normally when I do that in that method, I usually calm down.
Right.
Like
okay.
When
yes.
Our children are angry, we are giving that method. Ask them to count 10 to 1.
Backwards.
Yeah,
yes.
backwards.
It's not cliche, Rifka. This is actually an effective method that you need to do when you have anger issues. It is a very effective method. What about Pubudu? What is your method of calming yourself in anger? Because we are going through an anger situation. What do you think is helping?
Yeah, I have faced to anger situation. Most of the time, I am leaving the place and drinking a glass of water. That will eliminate the anger.
Okay. I think I can learn from y'all in that aspect. Very good. And Nithni, what about you? How does it help you to control your anger?
When I get angry, ma'am, I normally tell to my parents about my anger, and I ask them how to get rid of my anger. Then my parents discuss with my matter. They normally in my choice they normally said words like, "Okay, you have told us your situation. We will guide you with the correct part." So that's the thing I do.
Yes, actually, I don't know, maybe the ones who are here. Taranga, do you think your anger is more now or as in your early teen or early youth? What do you feel?
Miss, now I am a little, when I was younger, I am getting angry so much.
Right.
And now I am matured. I think I am very matured. I am not getting angry anymore.
That gives me hope too. Rifka, do you agree with Taranga on this?
Yes, I agree. Now, like
Do you
comparing to my younger days, I think yes, I can control myself. But only thing like when you are like loaded with work, yes, it'll be a little bit difficult for you to control your anger as well. So I think we all go through some stages when we are
now itself nowadays we are more than 30 now. Now we are doing is we are controlling our anger, doing something like with without getting angry. We are like that. I can't tell it with the මොනවාද බඩුත් එක්ක අපි ඇඟ එක රියැක්ට් කරන කියන්නේ බඩුවක් පොඩ හයියෙන් දානවා අර ඒ ඇඟ එක එහෙම පිට කරලා ඒක ඉවර කරනවා like that අර ඉස්සර අපි එහෙම නෙමෙයි ඉස්සර we are shouting to the children and like kind of things we are doing but now අපි අපේ බඩුවකටින් හරි ඒක පොඩක් සද්දෙන් දාලා ඒක කන්ට්‍රෝල් කරගන්නවා ඒක
I think I am learning a lot from them. That's good. Because all of you are, I think, older than me. Yes, go on. Yes.
කේන්ති වැඩිපුරම කියලාවට වතුර බිව්වම මම ඒක මේ ඉන්ටර්නෙට් එකේ දැක්කේ මතක නැහැ අතරින් කියලා. වතුර බිව්වම වෙන දේ තමයි මේ ඇඩ්‍රිනලින් නොඇඩ්‍රිනලින් දෙකම මේ කන්සන්ට්‍රේෂන් එක අඩු වෙනවා. කොට අර අපි ෆයිට් කරනවා වගේ
I want to know how the Pubudu who said this? Who said this? What was it? Pubudu? Okay.
Yeah.
Thank you, Pubudu. Actually, you're the second one who said this. Actually, student, I have very bad anger issue, right? This workplace, all the people said, Miss Afida, you're perfect as a teacher, but the problem is you have a lot of anger, right? Mama, mage taraha is like a monster with my students, especially because I'm dealing with teenagers. Harima amari, like very difficult, like ඒගොල්ලන් සමහර වෙලාවට ඊට පස්සේ මට හරි දුකත් එක්ක ඊට පස්සේ ඒගොල්ලන් sorry letters ගේනවා හැබැයි ඊට පස්සේ like with me I told my father and my father gave me some good advice. He said that the best thing is if you are angry, try to walk out of the class. Or I think like Pubudu gave a better advice is to drink water, because I think drinking water will do two things. It will help you to reduce your anger and it will keep yourself hydrated also. So Pubudu, thank you for that advice. And I think counting backwards problem is what
we can talk to ourselves also.
Yes, reflection again. Yes. I do this actually. A problem with me, Rifka, when my anger comes, I forget to count. Right? So it doesn't.
Ma'am,
Yes, Janaka.
Even if I get angry, I act like I am not angry with others, and I am not going to show it.
Okay.
No, I don't think about anything. I'm thinking everything is going to be fine. I continue with my self.
I think like Taranga said, it also comes with maturity, right? Because I think if you have children, right, and if you become a parent, your tolerance is a lot, right? Because what you go through with your children, I understand how much. Even today, my parents go through a lot because they are worried about me because I'm in another country. They are worried until I go to a new apartment. They are worried about a lot of things because I'm like a lot of things, right? So I understand to being a parent is one of the hardest challenges, right? So once you become a parent, right, all these little things doesn't affect you anymore because you have become disciplined and you have learned to be facing the challenges in a stronger way. Right, so I think I learned a lot of good examples from you, right? So, hold on a second. Okay. Next one. So like some of you all said you all can talk to yourself about it, right? And then now what, right? Now what do I need to do in order to make things better? Now like now for me usually mata tarahan, I will tell you, in my workplace she was a drama teacher. කොච්චර තරහා යනවා නම් එයා බඩු විසි කරනවා ළමයින්ට, right? She throws things at the student. She's a good teacher, but you understand teenagers are very difficult, right? ඒ තරහට එයා බඩු විසි කරනවා ළමයින්ට because ගහන්න බැරි නිසා ඒ තරහට බඩු විසි කරනවා. Usually I don't have this thing in me. The maximum I have is when I'm angry, sometimes I can shout at somebody and not using bad words, but that tone of my voice can be hurtful to people, right? So of course now I have better anger management, right? But always we can ask ourselves how we can do things better, right? And what broader issues we need to consider in this action, right? So we need to know if something made me to get anger, I need to ask myself, what made me to get anger? How could I do it better next time for not being angry? So you all already gave me your techniques, right? So that is that. Three main questions are what, so what, and now what, right? So try to understand. I didn't go detail in everything, but just know what is the description level of reflection. That is your self-awareness. And so what is the deep critical analysis and evaluation, right? Why did this happen to me? Now what is action-oriented level of reflection? That is, you need to know what you can do to avoid this situation next time, right? Next is we are going to learn about tools for self-assessment, right? So the first one is skills evaluation checklist, right? The description for this here is you will check your skills, your knowledge, right? Where an individual perceived level of the ability rated on a scale. Poor, very good, or good, or like that. Can somebody give me an example for this skill evaluation checklist? When can you use this, students? Any skill, can somebody tell me? We discussed this, but we are trying to now assess it with a tool. Can somebody give me an example? Skill evaluation checklist. Based on this description, can you give me an example?
Hello.
Yes.
Yes. Language.
Okay, good. How
Yes,
would you
language.
rate that? How would you, what language? Let's say English, Rivka, or maybe another language you want to learn. Okay, how would you evaluate it?
Like even in English, like you can categorize it into writing, then speech, and then yes, what is it there? Yes, writing,
speaking, listening,
okay. Something like that,
and reading.
And then yes, depending that categories, we can rate it whether the language skill, the writing is good, very good, poor, like that.
Okay.
And
very
also that customer care service, we can tell that very good. We can mark like very good or good or bad or
excellent. Yeah, it didn't even come to my head. Thank you, Taranga. That is also very good. Yeah, like usually, like even in Facebook, අපි මොනා හරි තැනකට if you want to check in or if you want to check into a restaurant, ඉස්සලාම අපි පොඩ්ඩක් බලනවා Facebook එකේ මොන stars the 3 the 4 the 5 stars the. We just try to see the customer review. Based on that, we will feel okay, it's worth going to this place, it's worth spending our money on this place, right? Yes, that's a good one. Janaka Pubudu, do you have any example for the skill evaluation checklist based on this description and example that you all like to give?
Really no matter.
Anything. It could be a language. It could be a customer service.
Anything. Taxi driver also, that app we are giving, no, that after the service we are giving that good driver, that like that.
Exactly. Yeah, very good. You can give an assessment for somebody's service, right? You can give it for a service for a person, right? There were 5 people who have joined the company, right? The CEO or the boss of the company wants to select one of those 5 people, right? එතකොට එයාට අපි කියනවා මේකට ඉංග්‍රීසි වලින් rubrics RUBRICS rubrics, right? ඒ rubrics එක they just give good, very good, excellent, exceptional, right? එතකොට අපිට categorize කරන්න පුළුවන්. මේ first එකේනා just good, second එකේනා very good, third එකේනා excellent, right? So you will basically you select one person based on the evaluation checklist. Okay?
And also, Miss Africa,
yes.
IT literacy.
Yes, literacy. Can you elaborate that a bit, Rifka? How?
Yes,
How
IT
you...
literacy, like that also, like there are different kind of, like when it comes to IT, yeah, Word, I don't know, Word, Excel, like PDF, they will, like, can we do it like that?
Of course, you can. No, why not? That's a very good thing to do. Even I didn't think about that, right? You can do that, right? But depends, Rifka, in what are you trying to assess that in that evaluation checklist, right? You can use different tools. But my question was, when do you use that tool? You get what I'm saying, right? Maybe it is a skill that you're trying to assess in somebody, or maybe you're trying to rate a particular service, right? But how you are going to do the assessment or how you are going to do the evaluation, you can either use Excel sheet, you can use anything or anything. You get what I'm saying, Vishka? How you are going to, yes, that's what I'm trying to say, okay? And then next one, we are going to go to the SWOT analysis. So SWOT analysis of an individual strengths. Example, what do you do better than anyone else? What are your achievements, weaknesses, right? What tasks do you avoid? What are your bad work habits? What are your opportunities? How much you grow in your role, right? What are your external career opportunities? Right. Rifka, I think you were absent the past 3 weeks. I asked everybody a question. How do you plan yourself for your long-term goals? Can you just explain to me what helps you in your long-term goals? Can you explain it to me? How do you, like, let's say you have monthly goals or yearly goals. How do you accomplish your goals, students? How do you accomplish your goals? Like, how do you plan out to accomplishing your goals? Do you write in a journal? Do you work on something? What is your method to know what you want?
I write in a journal. I write in a journal. Like normally what I do is like, like if to take my personal life as a whole, what I do is I have this book, but for this year, I will have like to-do list. So I will have a to-do list. Then in that to-do list, I will write what are the long-term plans and what are the short-term plans I have.
Wow. Okay. You actually do this, Rifka, right? You really do this.
No, actually, I started it this year only.
And have you been consistent with that?
I think I have, and inshallah, I hope to be consistent in the like future as well. Now the thing is now my husband very recently migrated, so there's so many plans now. Since he is not there, I'm the person who is responsible in looking after the house. So there's so many things I have to achieve. So because of that only I started this.
Very good. Actually, can you see, that is why I mentioned yesterday also, when you have a journal, right? When you write your yearly goals, your weekly goals, your monthly goals, it gives you that discipline, that focus, right? What exactly you want to achieve in life. You will know what your purpose is in life, right? Even yesterday, I think Taranga told me she also write like what she wants to accomplish, what she has already achieved, what she has learned, what she needs to improve further, right? And the best part is people think that writing on something is old school. It is really not old school anymore. You really learn a lot of things by writing. I think it is a very essential tool because you get to know your weaknesses, your achievements, what are your work habits, right? All that, okay? Students, just give me a second. Please give me 3 minutes. I will be back. Okay, so we learned about skill evaluation checklist, and we also learned about what is SWOT analysis. Now we will go through the professional development plan called PDP, right? So the description for professional development plan is structured and detailed approach to reflect on an individual's learning, performance, achievements in order to plan for their future, also described as past, destination, and plan. Can somebody give me an example for PDP? What do you all think? Students, professional development plan. Can you give me an example for PDP? Rifka, based on performance, achievement, and plan. Can you give me an example?
Okay. Yes, I will. I will just take the autumn as an example.
Okay.
So now we are doing the autumn level 4. So like we are doing the assignment. Once we complete
Yes.
our assignment.
Yes.
So we will be graded, and depending whether we have passed or failed, we can plan for the next level, which is the autumn level 5.
Right. Very good. Very good. So achievement will be, learning will be, or performance will be how well you have covered your lectures, how well you have understood the lectures. That is your learning. And then performance is how well you do your assignments, getting a good pass, right? Getting a pass is your achievement in every module, right? And then planning the future, now you have the confidence and the skill and also the practical knowledge and theory knowledge to go to the next level of author, right? So that's a good example. Taranga, would you like to give an example for professional development plan in your career for yourself or for your students? What would you do? Taranga, are you there? PDP?
Yes.
Oh,
Yes.
yes. How would you do?
Now, I can plan that about my career. Now I stopped that the daycare and Montessori. Now I am doing this course, regarding to health and social care things.
Right.
Because I have to achieve my goal.
Right. So you are not running the school.
Doing some yes. I started the level 7 also in here, that autumn level.
Okay. Okay.
Okay, then because I have to achieve my goal.
Right. Right. Okay. So you are not running the school anymore, is it? No, you are not running the school anymore.
Yes, miss. My goal is we are planning to migrate.
Right. Okay.
So
okay.
very soon. So my
Right.
husband already left.
Right. Yeah, that is actually this is I don't know, this has become like a disease in Sri Lanka. අහන හැමෝගෙම ඉතින් එකම දේ තමයි migrating from Sri Lanka, right? I mean, including
because
myself.
Of this situation. We can't do the business here.
Yes, I know.
We lost everything because of this situation. So can't do anything. So thinking about our children, we have to left the country.
Yeah, that's the thing. Yeah, I mean, that's like I said today, even, yes, Rifka, go on.
Yes, sir, ma'am. The thing is, even my husband has he left now, I think 2 weeks back. He went to UK. Now he has gone to his studies. So my plan is also, inshallah, to join him like within next year's time. So that's why I said I'm like maintaining this journal, so that he has asked me to get my IELTS as well. General IELTS. There are so many things I have to achieve within a very short period of time. So that's why I need to, organize and list out what are the things I need to achieve within the period before I leave.
Exactly. So, I mean, it is a sad situation, because even today in what you call in batch 2, right? Everybody who I ask, their one and only goal is, they say that they want to leave the country, right? Like Taranga said, today's situation is like that. They have no choice. Like even for me, right? Including my own self, right? I am just starting in my career right after my master's. So I also want to develop my profession in this situation, right? Like I want to go, because there is no other choice, because this is what has happened, the sad state of our country, right? So Rifka, I think you missed 3 weeks of lectures. What I was trying to say, our country as a whole has collapsed because of lack of professional development, right? Because last time Janaka proposed that for the issue of electricity, he suggested about solar panel. And then Taranga said her husband was using that as a business, but because it has to go through a certain governmental sector, you cannot do a business in the country. So the professional development is lacking in our higher authority, starting from the president, starting from the cabinet, right? So as a result, everything under this is actually has collapsed, right? So and you also have to know that professional development is an important thing, not just for us, but for the whole.
And also, Mr. Afrida, a lot of people who have professional qualification and who are very well educated are leaving the country. I think that will be like a very bigger downfall to Sri Lanka as well.
Already this was also discussed about by Taranga last week, and Janaka and all these people said the same thing, that all the educated professionals have left the country already. And my mom, she just told me 2 days ago, like a lot of robbery is happening now in Sri Lanka, like in Dehiwala area, because I live in Dehiwala. Like almost every neighboring side, that there's a lot of robbery that is happening. ඉතින් මේවා I think අනිවාර්යෙන් වෙන ප්‍රශ්න, right? When inflation goes up, when people don't have job, they need to survive by eating food. The best way they think is by stealing, right? Because end of the day, and now you will wait and see, just like the robbery is going up, murder will also go up, where they start stealing for organs, right? They will kill you for the gold, right? So it's a very sad state, actually very sad state. For me personally, if it wasn't for my parents, I have nothing left in Sri Lanka anymore. Right? I really, for me, that country has been so much of pain. That's all I can say in every aspect. I have no happy memories anymore about Sri Lanka. Right? I told
and also this thing now, even the ordinary level exams have been postponed. Again. So a lot of parents have the concern for their children's future. And that's the reason I think most of the parents are leaving the country, because of the future of their children also.
Exactly. Like as parents, they always think there is nothing more for me. Now I have to do for my children, because what is going to happen to my children? Because last time also I saw on Facebook, they have asked for some fundraising because children are lacking certain funds for their basic education. I hope and pray that each one of you all who wants to leave the country, that it will work in your favor, because truly we are going through a very bad and a dark era. One of the worst eras. Even I think when we had a war, we didn't go through this sort of situation, right? So this situation is a very, very scary and a very difficult situation that we as Sri Lankans are going through, right? So yeah, so like I said, like last time also I gave an example, when somebody is having a cancer, you can't give a chemotherapy and expect that person to be treated, right? You need to first of all take the tumor. Once you extract the tumor, then when you give the chemo, then that is when it gets responded. So the tumor in our country is our government, right? Until we get rid of our good government comes, this cancer will continue to go and go and go until a death comes, right? That is the correct thing, that how to look at it, right? Smart objectives, because you were not there, right? I will just go through the smart objective one more time, only that slide, okay? Because I just remembered that you were not there for. I should have put that diagram in this slide also, but I haven't put. Hold on. Yeah. Rifa, can you see the SMART goal? About specific, measurable, attainable, and relevant and time bound. Can you see these criteria for SMART goals? 1, 2, 3, yes. 4, 5. Yes. Can you give me an example when you are using a SMART goal? What does it mean to be specific? What does it mean to be measurable? What does it mean to be attainable? What does it mean to be relevant? And what does it mean to be time bound? Can you give me an example? Because that is what we are going to discuss in the slide, in the next slide also, the slide that we were just discussing. Can you give me an example for these 5 criteria?
Yes, for an instance, some kind of a qualification, if we are to pursue.
Mm-hmm. Okay.
Okay. Yes, I will take again the autumn qualification. So the
right.
So the being specific is that the autumn qualification.
Right.
Yes, measurable.
How?
Measurable, achievable. Sorry, measurable. Like, how can, no? I'm sorry. I got a little bit
No
lost.
problem. If you want to start again, you can start again. It's going to be helpful for other people to recall also, because this 5 criteria is very important. Whatever the example that you choose, what can you think? It could be even learning a language or a particular skill. Let's say that you want to learn a language. How would you classify it according to 5 things?
Okay. Yes.
Okay, Taranga, you can go on then. No problem.
Yeah. Now it's specific. Now we can ask like who is involved. What do I want to achieve?
Very good.
When do I need to achieve this kind of question? Why is this important? That about that Riscatol about the autumn.
Right.
We can. Yeah. Then measurable. How will I measure my progress?
Very good. Right. Okay.
How will I know if my goal is achieved or not?
Okay.
Like what?
Okay.
Then achievable.
Yeah, achievable. How would you?
Will it be clear when the goal is complete?
Okay.
Then relevant. Is this thing that thing related to my overall success?
Okay. And time bound. Last one, how would you do?
How long should it take?
Very good. Okay, good. Rifka, did you Yes, thank you very much, Tarang.
I understood.
Rifka, how can you now apply more on this specific, measurable, attainable, relevant, and time bound? Do you think you can now answer based on these 5 criteria?
Yes, I'll take a language. So learning French. We'll think, okay, we are going to learn French. So how are we gonna, what kind of an institution we will, go to do this specific, to learn this specific language. Measurable is how can we measure our success, is it?
Okay,
yes,
good.
We are like if there are stages to learn French, a diploma level, or like a diploma level, and then a degree level, those kind of stages, how we can measure, and then whether it's achievable, whether we can achieve this, in learning this language, and whether learning French is relevant for us to for any kind of a goal of ours. Like if we are to go to Canada, we need to learn French. So then yes, it is relevant that we learn French because it is a second language in Canada. And then the time we spend to learn that language, if it's a 1-year course, whether we can be achieved the outcome within the time frame of 1 year.
Okay.
I think
it's actually why I keep asking this question is because sometimes you might get in the assignment and you need to sort of like quickly give an example. So for example, like I said, if I have to repeat again, specific means you want to improve your English written skills, right? Then you need to be specific about improving your writing skills, not about communication, because you are good in communication, but you're not good in writing. Example, na Rifka, right? So specific is writing, written, being a good writer. Measurable means you give 1 month or you give a maximum of 1 year to improve in your writing, just 1 year, right? So you can't just say, I'm going to be a good writer in 1 month's time or in 2 months' time. You have to give at least 1 year to be a good writer. Achievable or attainable means you are confident that within 1 year, you can achieve to be a good writer, right? That is achievable, right? And then relevant means you take relevant courses, you take relevant workshops, you take relevant seminars related to writing. You don't go related to speaking or IT or drawing or singing, because what you want now is to improve in your writing. So you have to take relevant courses regarding writing, right? And then time bound means you have to have a deadline. Like for example, yesterday I was telling, why do we need deadline? Because deadline will give us some sort of discipline, right? So if autumn doesn't give you a deadline for 3 lecturers assignments, you will continue to do this diploma maybe until death, right? That is why we have a deadline, because a deadline can give a discipline to a person to achieve a particular thing in a given time span, right? That is the main reason of a deadline. That is why we say time bound. So if you can work hard to be a good writer within 1 year, that is a great accomplishment or that is a great achievement. Okay. Do you understand, Rifka, how we categorize it, an example in these areas? Yes or no?
Yes, yes, I understood.
That is why, student, I ask you all, I know some of you all don't attend classes for valid reasons, but it is nothing like coming for a live session. One thing is watching a recording, you will feel a little bit, it's a recording. But when you are in live session, especially with me, I will like pick your names. I will ask you to say it. And one of the reasons I repeated it, because I want to be fair on the people who got absent, because I know watching a recording is not very efficient, right? So good. So we know about smart goals. Hold on. Yeah, hold on. Sorry. So that is about the SMART objective, that which we discussed now, right? So like I said before, the first thing is planning and the second thing is doing, right? So for example, if you have a continue, but can you tell me again, what is CPD, students? What do you think CPD is again?
Continuous professional development.
Right, very good, right? So post-qualification studies. Rifka, what are post-qualification studies? Or Tharanga, anyone? Can somebody answer? What are post-qualification studies?
Yes, that is like once we complete our school, the higher qualifications we pursue.
Yes, the higher qualifications that you will pursue. Like, for example, after I finished my degree, I went for my master's, right? So some of you all, after finishing Metni, hopefully she wants to do her school. Then what is it? University. Like for Ifka Tharanga, maybe not Tharanga said, after her diploma, she says she has gone all the way to level 7, right? So Ifka, hopefully you too, after this, you will go to another level, right? So each one of us will have a post-qualification studies, right? So it could be it could be a certificate level, diploma level, master's level, or doctorate level, right? One of these things, right? So you will keep going up, but also make sure that you go up in skills too, not just a paper qualification. So formal lectures, we can give it either as a conference, as a course, or congress. Can somebody tell me what is the meaning of a congress? You know courses and conference. What is a congress? Can somebody tell me what is a congress based on what you all know? I can.
ලෝකෙන් කියන්නේ සම්පූර්ණ හැම ගොඩක් රටවල් බහුතරයක් රටවල්
අනිවාර්යෙන් හරි කොංග්‍රස් UN කොංග්‍රස් එකක් අපිට කියන්නේ සාමාන්‍යයෙන් කියන්නේ අන්තර්ජාතිකව යනවා නම් ඉන්ටර්නැෂනලි යනවා නම් මොනවා හරි ලෝක ප්‍රශ්නයක් ගැන කතා කරන්න දෙයක් දැන් අපි IMF එකක් කියන්නේ ඒක කොංග්‍රස් එකක් right ලංකාවේ ආර්ථික අර්බුදයක් තියෙනකොට ඒ කොංග්‍රස් එකේ ඒගොල්ලන් සාමාන්‍යයෙන් ඩිස්කස් කරනවා they can discuss in IMF is a congress UN is a congress right where a lot of international people get together to talk and discuss about an issue
voice of the people
voice of the people. Very good, right? Excellent, right? Then we have formal practical sessions like clinical skill workshop. Do you all know what is a wet lab and a dry lab? Does anyone know what is a wet lab and a dry lab? Anyone? Students, does anyone know what is a wet lab and a dry lab? Wet lab එක කියන්නේ සාමාන්‍යයෙන් if you have gone to the Durdans or to any hospital lab, usually if they have to take a patient's urine sample or a blood sample, that is a wet lab because nurses and researchers are actually working in a lab to draw the patient sample, to analyze a patient sample. That is a wet lab. A dry lab is usually some researchers, they work everything on the computer. They don't go to the lab. They work from home, right? That is a dry lab. You don't work with equipments, but you just work with softwares. That is a dry lab, okay? So try to understand wet lab and dry lab. Now in my medical research, I have a friend who is doing her PhD dry lab, only software, because she doesn't like to go to the lab much. She operates everything with softwares to find new drugs, discovery of new treatments, like that, right? There are a lot of softwares that you need to know how to operate, right? And then you have online learning, like for example, webinars. So what you all are doing now is an online learning. So it can be Teams, it can be Zoom, right? Like that. And then we have work-based learning. So the work-based learning is you can conduct a clinical research like what I did, right? I'll just take few examples. Pharmaceutical, you can do it, pharmaceutical practices, right? Then what else can you say? Do you all remember the word morbidity and mortality? See, we are coming across these two terms. Does anybody remember what is morbidity and mortality, students? What do you think?
Mortality is like the harm to a person's life.
No, mortality means we've got a completely death. Yes, maraniya kyane mortality. Right? Death is mortality.
Paralyzed?
Very good. Morbidity is paralyzed, right? Remember these two words very well. Morbidity means something has harm has happened. As a result, that person can't walk. As a result, the person can't function or they can't do anything physically, right? Mortality is a bit serious than morbidity because now that person has completely died, right? So usually when I do clinical trial, if I treat a patient with a particular drug, right? Adverse effect එකක්. Like we give a particular drug and let's say the patient has vomiting, diarrhea, they have to call immediately. So they call us and we report it to the doctors because we work together. So at that situation, morbidity, we call it as a morbidity because their normal activity has now got disrupted, right? Mortality means completely due to a situation, they have died. ඒකයි අපි සාමාන්‍යයෙන් clinical trial එකක් කරනකොට සාමාන්‍යයෙන් we don't take people who are very old or we don't take patients who are very sick because we are worried. We don't know when they are going to die, right? Because and later අපිට කියන්න බෑ අපේ මේ drug එකක් නිසා තමයි ඒ patient මැරුණේ කියලා because they can always self blame. That's why clinical trial is a very risky job. Very, very stressful job, especially in Sri Lanka. It is a bit difficult to do, but it's a very highly paid job in USA. Australia is the highly paid job for clinical trial, right? What is self-directed learning, students? Can you all tell me what is a self-directed learning? We just have 2 more minutes. We will stop from this slide. Can you all tell me what is self-directed learning, students?
Is it to
learn one-to-one? You learn one-to-one, right? So I will like example when we all went to school or university, anything, that's a self-directed learning because you have a physical lecturer who is, you can see, they can see you, you can see them. They use resources like journal, textbook, whiteboard, smart pad, right? PowerPoint, multimedia, like that. Self-directed learning. So why I'm explaining this is for self-assessment tool, you just as how you plan, you need to ask these questions when you are planning. And when you are doing, you will do these kind of activities to continue your professional development area, right? And the final thing is you record, right? So this I will continue next week, but as a summary, right, I just want you all to take home this message, right? You plan, you do, you record, and you reflect. So what we are doing now is we are learning this a little bit in detail, right? So when you are planning, you will ask these questions: what, so what, now what? And when you are doing, you will go through these continuous professional activities like what kind of studies, how are the ways you will take your lectures, what are the practical sessions, right? These are your activities. Is it clear, students? Students,
Yes.
is it clear? You can
Yes,
ask
very
any
clear.
question. You can
Yes,
ask
ma'am.
any questions. So actually, like when I have made all these slides as per your syllabus, right? So you don't need to worry anything about reading additional. Even for your assignments, just to paraphrase, you will have to use journal, right? But you can always get the idea from this. Okay? If anybody else, Methni, Janaka, Pubudu, පැහැදිලිද? මොනවා හරි ප්‍රශ්න තියෙනවා නම් අනිවාර්යෙන් just ask, no problem.
Clear, ma'am.
Rifka, did you watch the recordings or is it clear now? Any doubts that you have?
No, I'm sorry, I couldn't watch the recording.
Exactly,
yes,
exactly.
that's
That's
right.
what
I was a bit confused with some of the things which you asked. So I will make sure that I'll go through the recording today.
Yes. So do that. But if you understood today's lecture, trust me, you're good to go, right? That is exactly why I always repeat a little bit on my previous slide, because I know there are people who have missed the class and I know they won't have the time because for whatever the reasons to watch the recording again, which is why I repeat a little bit again and again. So students, I will see you all next week. And thank you so much for bearing patience with me with all the background noise. I appreciate that for tolerating with me. And if you still have any questions, please write to me. I will answer your questions. You can send a voice message or a text message if you have any issues. But trust me, all these have been repeated again in the previous lectures, right? So go through the recording, and if you still can't understand, you can ask me anytime. Okay? Students?
Okay, miss.
Okay, thank you
Yes,
so
thank
much. Okay, students, thank you so much. Take care. See you next week. Oh, welcome, Pabudu. Take care. Take care. Tilani,
you.
take care. Bye.
Thank you.
Bye.